This is Dental Bytes, and this morning we are joined by Dr. Ryan Dunlop here, continuing our monthly chat with him from Better Life Center Implant and General Dentistry to discuss all things dental. And we're saying dental, but we're talking about something that people might not assume is dental related, sleep disorders.
Right, so sleep disorders are very common in the United States. There's over 40 million people who suffer from a sleep disorder, and it can absolutely impact your dental health, and your dental health can actually impact your sleep as well.
Okay, I know a lot of us have our ears perked up here because we work overnight shifts, and some of us have sleep apnea. I do. For those who aren't aware, can you explain what sleep apnea is and really how many people are affected by it?
Right, so like I said, 40 million Americans suffer with sleep apnea. It's about 1 billion people worldwide, but in the United States, only about 6 to 7 million people are actually diagnosed with sleep apnea. Now, how does this work? When you go to sleep, you lean back on your pillow, you lie down on your mattress, and as you can see from this diagram, the pressure from the gravity on the tongue and the throat collapses your airway so that healthy air cannot get into your lungs to help you breathe while you sleep.
Okay, so you're preaching to the choir here, but for those who don't know, how can it affect your life after? You sleep all night, or you try to sleep all night, but then you get up, and how is your life impacted?
Well, I can tell you from my own experience, a couple years ago, I started to feel like I wasn't sleeping well. My wife started to tell me that I was snoring really loudly, and I started to wake up very tired. My throat was sore, my lips were dry, and I started to realize that I myself was suffering from sleep apnea. So I went and got myself tested, and I did have a mild to moderate sleep apnea myself. So I really started my journey in trying to understand this and help other people who suffer from this condition.
Okay, so let's get to the treatments here. How do you treat sleep apnea?
So sleep apnea should be diagnosed by a medical professional. It's not something you want to treat yourself. The most common treatment for sleep apnea is what you see here, a CPAP or a pressurized breathing system. These are very cumbersome to wear. They're annoying to wear for most people. What I prefer to use is one of these modern dental appliances, and that's why I am so passionate about this topic, because I myself am using a dental appliance like a mouth guard that positions my jaw forward when I sleep so that I have healthy air getting into my lungs. So you can see an example here. These are some examples of some of the modern designed mouthpieces that I can make for patients that have mild to moderate to severe sleep apnea. So they connect the upper and lower teeth together and position the jaw so you don't have to wear that CPAP and you sleep peacefully without snoring all night.
Yeah, and some people, the CPAP takes a while to get used to.
Right.
I imagine this is the same. How long do you think before you get used to something like this?
For myself, I started to see improvement right away. Within a few nights, I was already feeling better. For my patients, I usually see an adaptation period of about 1 to 2 weeks.
Okay.
So we give people the mouthpieces, we calibrate them, we make sure that they fit correctly, and then we see them back 1 to 2 weeks later, and they're doing great.
Okay, so can you prescribe, as a dentist, can you prescribe sleep apnea? Or, not prescribe,
I can diagnose it, but if you want to have your insurance play a part and have them contribute towards the cost of some of these treatments, then you should have it diagnosed by a medical professional.
Okay.
And we work with sleep disorder doctors in the Valley here to get you the proper diagnosis, and then yes, I can make the sleep appliances for you.
Okay, yeah, I was going to say, because I know there's a lot of people who are out there probably saying, I've tried everything.
Right.
Maybe they haven't tried that. So how do they get a hold of you? How do we
so call my office at 559-435-3200 and make a consultation for a sleep analysis. We're going to take a CT of your head and throat, and we're going to see if you have a collapsed airway. I'm going to make a referral to one of my medical colleagues, and they're going to do the sleep study at home. So they do, like, you wear some contraptions at night, you get a diagnosis, and then you come back to me and we make you a mouth guard that can really, really improve the quality of life. We're talking about more energy, better confidence, more focus throughout the day, and adding years to your life. The average sleep apnea patient suffers about 10 years of life lost.
Wow.
So if you treat your sleep apnea early enough and in time, you're actually adding about a decade to your life.
Okay, that's enlightening stuff. I'm sure a lot of our viewers, I didn't know that, but wow. Okay, we're about out of time, but Dr. Ryan Dunlop, thank you so much for joining us as always. Very enlightening stuff. We look forward to the next meeting with you.
Thank you. Have a great day.
All right. You have a great day.
Dental Bytes with Dr. Dunlop is sponsored by Better Life Center Implant and General Dentistry.